How Kiskali works. Kiskali is a prescription medicine used in combination with an aromatase inhibitor to treat perimenopausal or postmenopausal women with hormone receptor HR-positive human epidermal growth factor receptor 2 HER2-negative breast cancer that has spread to other parts of the body, metastatic, as the first endocrine-based therapy, or fulvestrant to treat postmenopausal women with HR-positive HER2-negative metastatic breast cancer as the first endocrine-based therapy, or with disease progression following endocrine therapy. Kiskali is used in combination with the hormone therapy or fulvestrant. Let's start with a cancer cell. When you have this type of metastatic breast cancer, hormones like estrogen and hormone receptors can cause overactive signaling to proteins within the center or nucleus of the cancer cell. Two proteins linked to the growth of HR-positive HER2-negative metastatic breast cancer are called CDK4 and CDK6, cyclin-dependent kinase 4 and 6. When these proteins are activated, they tell the cancer cell to grow and divide. Hormone therapies work outside of the nucleus of the cancer cell to block hormones and hormone receptors, limiting overactive signaling to CDK4 and 6 proteins. Treatment with Kiskali works inside the nucleus of the cancer cell. Kiskali blocks CDK4 and 6 activity, helping to prevent cell division. So, as you can see, Kiskali and hormone therapy or fulvestrant work together both inside and outside of the cancer cell to help delay disease progression.
Indications. Kiskali is a prescription medicine used in combination with an aromatase inhibitor to treat perimenopausal or postmenopausal women with hormone receptor HR-positive human epidermal growth factor receptor 2 HER2-negative breast cancer that has spread to other parts of the body, metastatic, as the first endocrine-based therapy, or fulvestrant to treat postmenopausal women with HR-positive HER2-negative metastatic breast cancer as the first endocrine-based therapy, or with disease progression following endocrine therapy. It is not known if Kiskali is safe and effective in children. Important safety information. What is the most important information I should know about Kiskali? Kiskali may cause serious side effects, including lung problems. Kiskali may cause severe or life-threatening inflammation of the lungs during treatment that may lead to death. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain. Severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, skin pain, burning, blistering of the lips, eyes, or mouth, or blisters on the skin or skin peeling with or without fever. Heart rhythm problems, QT prolongation. Kiskali can cause a heart problem known as QT prolongation. This condition can cause an abnormal heartbeat and may lead to death. Your healthcare provider should check your heart and do blood tests before and during treatment with Kiskali. Tell your healthcare provider right away if you have a change in your heartbeat, a fast or irregular heartbeat, or if you feel dizzy or faint. Liver problems, hepatobiliary toxicity. Kiskali can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment with Kiskali. Tell your healthcare provider right away if you get any of the following signs and symptoms of liver problems: yellowing of your skin or the whites of your eyes, jaundice, dark or brown, tea-colored urine, feeling very tired, loss of appetite, pain on the right side of your stomach area, abdomen, bleeding or bruising more easily than normal, low white blood cell counts, neutropenia. Low white blood cell counts are very common when taking Kiskali and may result in infections that may be severe. Your healthcare provider should check your white blood cell counts before and during treatment with Kiskali. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections such as fever and chills. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking Kiskali if you develop certain serious side effects during treatment with Kiskali. What should I tell my healthcare provider before taking Kiskali? Before you take Kiskali, tell your healthcare provider if you have any heart problems, including heart failure, irregular heartbeats, and QT prolongation, have ever had a heart attack, Have a slow heartbeat, bradycardia. Have problems with the amount of potassium, calcium, phosphorus, or magnesium in your blood. Have fever, chills, or any other signs or symptoms of infection. Have liver problems. Have any other medical conditions. Are pregnant or plan to become pregnant. Kiscali can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with Kiscali. Females who are able to become pregnant and who take Kiscali should use effective birth control during treatment and for at least 3 weeks after the last dose of Kiscali. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed. It is not known if Kiscali passes into your breast milk. Do not breastfeed during treatment with Kiscali and for at least 3 weeks after the last dose of Kiscali. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Kiscali and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. What should I avoid while taking Kiscali? Avoid eating grapefruit and avoid drinking grapefruit juice during treatment with Kiscali, since these may increase the amount of Kiscali in your blood. The most common side effects of Kiscali include neutropenia, nausea, infections, fatigue, diarrhea, leukopenia, vomiting, hair loss, headache, constipation, rash, cough. Kiscali may cause fertility problems if you are male and take Kiscali. This may affect your ability to father a child. Talk to your healthcare provider if this is a concern for you. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all of the possible side effects of Kiscali. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information, available on www.kiskali.com.